My first exposure to Dream Cream was somebody gave it to me as a gift. I had recently had surgery, and it said on the Dream Cream that you could use this for scarring, and decided to try it on my scar. I also had a previous surgery, the same type of surgery. I've had bilateral hip replacements. Did not use the Dream Cream on the first scar and used it on the second scar. The scarring appearance is just amazing. My personal experience with Dream Cream has been just wonderful. From a professional perspective, I've used it on I've recommended it to a lot of my burn patients. The burn patients that come in that have used Eucerin, and some of them have even tried several other different products that, some of the ones that are have less alcohol content. And the difference between using the products, the over-the-counter products, such as Eucerin, and some of the other ones, the difference between the Dream Cream and using the Eucerin has been amazing. The healing process, the scarring, it has been much less using the Dream Cream. There was a particular burn patient that had problems with the Eucerin, which again is not very common because it's a product that has less alcohol content, so therefore most patients do well with the Eucerin. But we've had this one burn patient in particular who came in and was having almost like an allergic reaction to the Eucerin. His skin was bright red, he was getting more hypergranulation. So I recommended him using the Dream Cream, and it was just amazing, the difference, how he healed, how much better it looked. And to this day, a couple years after his burn, barely noticeable that his burn is there. Yes, I recommend it to any patient that comes into the clinic. Some patients can't afford the more expensive creams. Some of them will ask if there's a generic Eucerin. I highly recommend and have a sample of the Dream Cream in my office to show the patients the difference, and that it's worth the expense to purchase the Dream Cream and use that on your burn, especially not only for the dryness, but for the scarring and helping settle the nerve endings down. It tends to work better. It's important to keep the skin hydrated because as the burn is healing, the skin is very dry and it wants to tighten. The Dream Cream helps. We always recommend 5 to 10 times a day, lotioning and massaging. But I have found with patients that have used the Dream Cream that they don't have to use it as frequently, and a little bit of Dream Cream goes a long way.